Hello, SEIU-UHW members and Healthcare Justice California patients and consumers. My name is Hortencia Armendariz, Healthcare Justice Division Director, bringing you today's daily updates. Why don't we log on to our SEIU-UHW account so that we can get the updates. So when you go to our website right away, you'll see the COVID-19 pandemic and the link to the latest updates. For today's latest updates, we have, a couple of news to share. We have been talking all week about our fight with employers who are taking advantage of the situation and trying to implement cuts either to wages or to benefits. So we led our first action yesterday. We'll be talking about that. We have another action coming up tomorrow. We've also been having conversations about, what are the conditions for reopening that healthcare workers think should take priority. Yesterday, we launched the first kickoff session for the Resilience Toolkit. What is the Resilience Toolkit? Let me tell you about that in a few minutes, but why don't we get started? We had our first ever socially distant picket at the Prime Healthcare Systems. We were at the Garden Grove, Encino, and Centinela hospitals. I personally was at the Centinela hospital, but you'll notice from this photo that it was a socially distant enforced protest. We had about 10 workers that were coming out at a time and rotating, but we hear that inside the hospital at Centinela, the workers could also hear the 21-car caravan that patients from Healthcare Justice California led. They could hear it inside, and it was really great for these healthcare workers to feel the support. But the healthcare workers continue to fight and continue to have demands to protect their sick leave, to protect their benefits. They have sessions coming up, and you can click on this link to check out the TV coverage. And so I'm going to share with you a short clip.
All right, meanwhile, Prime Healthcare employees picketed outside the Centinela Hospital Medical Center in Inglewood this morning. It was one of 3 protests held outside Prime Health hospitals across the Southland. The workers are fighting back after they say the hospital chain proposed to cut paid time off and disability benefits. The employees also claim they are being underpaid.
So as you can see, it was a very successful first action. The workers sent their message across, and the patients were there to support the workers. And now, we're not done here. Tomorrow, we're calling out Stanford. And so in the daily update, you'll be able to see information about articles that continue to pop up about Stanford and how they're making these cuts while hospital CEOs keep their 7-figure salaries. And tomorrow, if you are in the Silicon Valley area, join us for this action. So in addition to that, I want to share with you all our checklist. Let me share this. This is our checklist for reopening. It's also on our daily update. It's very important. We've had conversations about, are we ready? Are we not ready? What healthcare workers have to say matters. And we want to make sure that you have this checklist of questions that need adequate answers to ensure that we reopen safely and effectively. And so I'm just going to go over briefly this labor management checklist for the COVID-19 reopening. Talks about timing and criteria. What are the questions that we should be having with our management about the timing and the criteria that should be a part of reopening? The conversation about personal protective equipment, that is still an issue. We still need to ensure that we have enough supply. What are the conversations around that we're having with regards to reopening? And how are we safeguarding the facility? So we have a whole list of questions around that. And testing for healthcare workers is really important. We have questions around that. And staffing. We have seen some attacks against short staffing, furloughs, but we still need to ask some important questions here around staffing. And you need to get the answers from your managers. And staff support. How are workers going to continue to get support during these challenging times? And we got to talk about the money. What are the finances, right? How are we anticipating census numbers returning to pre-pandemic levels? These are all very important conversations that healthcare workers need to be management in order for us to decide, you know what, is it the right time or not? Again, housing alert. There is Airbnb lodging available to us. Click on here, join. And then yesterday we launched the Resilience Toolkit kickoff sessions. These are 25-minute sessions where you can learn what is the Resilience Toolkit. People are talking about the Resilience Toolkit. Have you heard about the Resilience Toolkit? If you haven't heard about it, we have some Zoom sessions. On Saturday, we have a Facebook Live session. And then next Tuesday, we have a Facebook Live session just to tell you what the Resilience Toolkit is about. But if you already know what the Resilience Toolkit is about, you can start with your self-paced modules today. We launched the first module for the Resilience Toolkit, and resilience is our ability to respond to challenges quickly and swiftly. And the toolkit is going to give you that training that you need, that awareness that you need, and practices so that you're able to self-regulate during these very challenging times. We've heard the stories of our healthcare workers and the struggles that you're going through, and we brought this resource for you so you can learn some techniques that you can apply to your daily practice. Click here on the link and it'll take you to our landing page where it has all the information. You put in your email and then it gives you access to the Resilience Toolkit. And this is for our SEIU-UHW members and Healthcare Justice California patients and healthcare consumers as well. So those are the daily updates for today, May 6th, and I look forward to talking to you tomorrow. And I invite everyone to continue looking through our resource page and learning about all the benefits and resources that we have at your disposal. So have a good day and talk to you tomorrow.